the little ones. Yep. Hi guys, this is Charles. I'm one of the surgeons at Southpaws. So this afternoon, this is the same patient that we just did a tibial crest transposition on, and I'm doing brachycephalic airway surgery. And so I've got the nares sitting right here. And one thing that I've discovered recently is if I put a stay suture right up here, then I have somebody retract on the stay suture. As I'm making my cut and as I'm closing, you get a lot more exposure of the inside of the nasal cavity. So I put in a little simple interrupted suture. This is 4O PDS. And I'll just get my assistant to retract dorsally, and you'll see how much more exposure we get. Go ahead and cut that off. Yep. All right, so now when we retract that up, we can see into the nasal passage a little bit better. I'm going to, see, I'm just going to change. Just make that a little bit brighter. Okay. So you can see a little bit better down the airway. So I do a vertical wedge. I also find that when I retract dorsally using that suture, that I get less bleeding as well. So I'm going to make a vertical wedge starting my apex right where my suture is. I want to be careful not to go too deep or too far proximal. And then I'm going to make almost like a pyramid cut. It's really important when you do these that you go quite far into the nasal cavity, because that extra thickness often is quite far in there. And then we'll take the other side of our wedge right here. Okay, so see what our piece looks like. You look in there, it's almost like a diamond shape. And then I'm going to take that stay suture, and I'll have my assistant continue to retract between bites. So I'm pulling it up as I suture, and by pulling it up, you also are going to help with hemostasis. So that I'm just going to run a little simple continuous suture pattern. And each time, we're going to re-grab that. And I'm wearing loops for this. I think loops are really, really helpful in any kind of surgery, but specifically on airway surgery. So lifting that up there. I assume you guys can hear me. Let me know if the audio is poor. And by retracting dorsally, I can get much farther into the nasal cavity with my sutures than I could otherwise do. And this is a recent addition for me. I kind of figured this out about 6 months ago. And I've been using it ever since and been really pleased with the results that I've been getting. Great. It's my last bite, and so I'll just tie this off. And I rarely have to take these sutures out. They usually stay in forever, and dogs just lick them out or snort them out. And they don't stay in forever, but I never take them out. And so now if you compare it to the other side, you can see how much we've opened up that nasal passage. Okay, so that is much bigger. You can see that really clearly. So I'm going to do the same thing on the other side. So starting off with my stay suture at the apex of where our wedge is going to come out.
You're not live anymore.
Yes. All right, so track that up like that. And then we'll just place our wedge as close as I can get to that suture without cutting it. And quite far into the nares. Get some nuts and bolts, please. Okay, so that's the little triangle or diamond shape that we took out there. Let me see if you can see a little better there. Okay, and then we're just going to close that up again in a simple continuous fashion. And I'm going to have a look at the soft palate. I haven't had a good look at it yet. I'm either going to do a folded flat palatoplasty or just a ligature. And I haven't decided which one I'm going to do at this point. But I'll try to video it either way. You can use that suture to provide some counterbalance. There's countertraction when you're trying to place your needle as well.
So I'll take a question about what suture type and size are you using?
So I'm using PDS, and I'm using 4.0 in this dog, and I'm using it on a taper needle. There's no problem with using a taper needle in the nose here. I go through again. One last stitch in here. All right, so that looks pretty good there. All right, so and you can see that that is just much, much more open. Now I'm going to try to tilt the head up, release this here, and then I'll have to zoom out in a second. So we've been icing the soft palate. Can you help me, please, here? And I'll reposition the camera when I get the dog positioned properly. So we'll get that in here, and then I have to get that up under the canine too. So pull this down here. Okay, and then this up here. And that canine tooth isn't far enough. That's it. Okay. And pull the tongue out. All right, so now I need to reposition the camera. I have it going over my shoulder. Zoom out a little bit.
Yeah.
Okay. Hopefully you guys can see what's going on down there. All right, so let's have a look. Can I get some debated forces, please? Where's the camera? Over my right shoulder. Yep, that's great. Thanks. Got my head in there. Okay, so just looking at the soft palate there, I reckon that I'm going to do just a ligature. So what I'll need next is, can I get some 4O PDS if there's any left, or if there isn't, then I'll get a new pack. I'm just going to put a stay suture right in the center. You guys watch the video and make sure my head's not in the way. So I'm looking up into the nasopharynx there. I'm just going to put in a stay suture right in the center here. And I will take a hemostat, please. Thank you. And scissors, please. Take that for me, please. Can I get my Satinsky? So basically, I want my palate, or my staphylectomy to come up even with about halfway down the tonsillar crypt. So that's the tonsillar crypt right there. I'll look on the other side and see if you can see it better. So that's my tonsillar crypt over there, and I want my staphylectomy to be even with about halfway down the tonsillar crypt. Now I'm elevating this out here, and I'm going to grab it with a Satinsky. Like that. Can we get some fentanyl, please?
What's that?
Fentanyl.
If he's on cigarette.
You might have to give him a little bolus. Do we have ligature plugged in? All right, and then I'm just going to ligature this out. The reason why I'm using ligature instead of doing a folded flat palatoplasty is because the soft palate is not that thick in this dog. So I'm just going to pull that out, and I'm going to come right behind. We're still getting a little bit of reaction. Have you given the bolus already?
Mm-hmm.
Yeah?
I have to get them at the bowl before, so I'll pack them as well. What right now, do you?
And right across with the ligature. All right, so that's how much soft palate we've taken out there. And now I can look right down into the airway, and I can see the epiglottis, and I can see the larynx and stuff. So I think we've taken out exactly how much we want, and that's pretty even with the tonsillar crypt. So I'm pretty happy with that. Now, I am going to look at the laryngeal saccs, but I don't think I'll be able to show you because it's just too far down the hole. I'm not sure. Can you see down there? Can you guys see the larynx? Bianca, can you see down the...
I sort of can, but the camera's out of focus.
Okay.
Yes,
It can zoom. Let's see here. I think that's pretty much zoomed all the way in, and we'll just raise it up a little bit. So you can see that I've taken out enough of the soft palate there that we can see the epiglottis. So now I'm going to have to extubate the dog. Deflate the cuff syringe. Can I get my pituitary rongeur? Right, so we're extubating now. I'm going to take some gauze. Those ones would be great. So you can use anything to grasp. I like pituitary rongeurs. I'm sorry if you guys can't see very well because my big head's in the way. Can I get you to retract on the tongue camera, please? So I'm going to reach down here with my pituitary rongeur and use my mixing bone scissor. And so that's the sacral right in there. So I've got a hold of it with my pituitary rongeur. And I'm just going to trim it out, and I'm trimming it out from all 360 degrees, being very careful not to cut the vocal fold. Okay, so that's the sacral that I've taken out on that side. sure if you guys can see that. So that's the sacral there. And now I know my head's going to get in the way. So there's the other sacral here. A nice view of the back of my head, I'm sure. Okay, so that's the other laryngeal sacral right there that I've taken out. All right, so now I'm going to re-intubate. Okay, and get the tongue out of the way. And we can reconnect that to the anesthetic machine. Alright, and then I'm going to release the jig and zoom out so you can see exactly how we have the dog's head position. So we're in this IM3 dental, it's for, I think it's for like rodent dentals. And I use them for brachycephalic airway. I think it works really well. Can I get a ice finger, please? So just before and after the soft palate surgery, we ice the soft palate. And ours, I think, melted, so we'll go and get some more out of the freezer. There we go. So we have a bunch of glove fingers. So you can see that here. So a bunch of glove fingers, and we're just sticking down the oral cavity up against the soft palate, and we just leave it like that for about 10 minutes before and after the surgery. So let's go ahead and pull out the mouth gag. So we've completed the surgery. We'll just let him rest here like this with the ice fingers in his mouth. Leave him like that for about 10 minutes, and then we'll wake him up slowly. So that's about it. Well, I hope you enjoyed that procedure. And don't forget to subscribe and turn on your notifications if you haven't already done so. So thanks again for watching, and we'll talk to you soon.